Hey everyone. So I really wanted to talk today about the importance of developing your guide hand. On my channel, I've talked a lot about how your guide hand or your oshide can really make or break your practice. And I've noticed that a lot of the times when I've been teaching acupuncture, either at the acupuncture school here in Denver, Colorado School of Traditional Chinese Medicine, or within ShinKyu University, which is my signature mentorship program, in order to get really it's almost like a residency program for acupuncturists. Um, well, not like it is. So within both of those programs, when I'm teaching people how to first utilize their guide hand or their oshide, I find that a lot of the same mistakes come up. And I've talked about this in some of my videos. So I'd like to talk about really how to start developing your oshide, and then also some of the things that you can really put into place, mentorship in particular, in order to help develop your practice. So the very first thing is that we're going to be utilizing our non-dominant hand as our oshide. So for example, I'm a right-handed person, and so my left hand is actually going to be my oshide. So for that, I'm going to utilize my guide hand, my left hand, around the shaft of the needle. If you can imagine this as a needle shaft. For a little bit easier understanding, I'll use one of my teishin tools. And so what I'm going to do is help to really use this guide hand to enclose my teishin at the tip. And then I'm able to both put horizontal pressure on the needle shaft, and then also I can put a vertical pressure. If you can imagine, this is the patient here, and I'm trying to insert the needle. And so both putting pressure down with just my guide hand and then on the shaft can really start to change things. So it's really, really important to start developing it. Now, I've noticed a lot of times when you learn it at a TCM school, you tend to hold your needle differently, which kind of mutes out the point of having a guide hand. And so most people, when they learn it at a TCM school, they're actually holding their needle from the side. Now, there's a lot of different reasons that I go into how to hold your needle correctly in the YouTube channel and also within ShinKyu University, of why you don't want to hold your needle that way. And just to kind of summarize it really, first of all, when you hold your needle this way, it's when you go to put it in, it's not always going to stay straight. It might start to bend, just simply because it's really easy to start changing the angle of that needle. And then over and above that, it's also very difficult to get accurate technique. So let's say if I wanted to do a very traditional TCM technique like lifting and thrusting, just to imagine, like, this is my hand here is going to be the skin. So this is already inserted. Now see how much this needle, the play of this needle starts to change the angle of that shaft. Now, if I'm really starting to be lazy, you can see how that can really start to arc within the body. And that becomes really difficult because, one, it could actually cause internal bleeding, so it can cause a bruise on your patient. And also, you might not actually be as accurate with finding that specific acupuncture point beneath your needle. And instead, you're just going to create achiness. So not even a dead sheet, it's just going to be achy because you're starting to really hack away at the internal tissue with the tip of that shaft of the needle. And so a really good way to get around that, I mean, we of course have all of these other reasons, namely which of channeling your ki through the needle is so important. And this just doesn't